Hi, my name is Han. I'm a student nurse, and I'm here to show you how to perform trach care. So I've already performed hand hygiene, reviewed my order for trach care, look at the IPN. So it says trach care 4 hours, every 4 hours, PRN, and 40% communication cold block. I already grabbed my supplies. I've entered the room, safety checked, identified the patient, and introduced myself. This is kind of a continuation of the previous video. So I'm going to go ahead and start off at explaining the procedure. So I'm going to perform hand hygiene. So hi, my name is Han. I'm a student nurse. I'm back here again with the trach care. And what I'm going to do is I'm just going to remove your old dressing of the trach, clean it, and put on new dressing, suction, and change the inner cannula. And the reason why we're doing this is to maintain a clean environment for your trach, and as well as the trach pathway. Do you have any questions or concerns? No. Do you require analgesics? Patient says no. Are you okay with this procedure? I'm asking for consent. Patient says yes, that's fine. So I'm going to go ahead and perform hand hygiene and prepare the patient. Before I do that, I'm going to wear a mask. But for demo purposes, I'm just verbalizing to wear a mask. And I'm going to wear clean gloves. Okay, preparing the patient, I would raise the height of the bed, and the head of the bed is already up. And I'm going to position myself appropriately. I would make sure to clear this, clear it, wipe it, and dry it. Then I'm just going to gently ask the patient. So is it okay if I just kind of remove your pillow? And the patient says that's fine. And I know that this patient is not contraindicated like spinal cord injury, so I'm going to go ahead and remove this pillow. Okay. Thank you. Now I'm just going to go ahead and perform my trach safety check. So I'm going to come over here. Look at my suctioning equipment first. So I'm going to check to see if it's functioning. I see that it's turned on already and it's turned on here. I'm going to check for the suctioning power. Okay. And I see that it's already set at 82/120 mmHg for pressure, which is very normal for a trach suctioning. I'm going to move on to my oxygen. The order says that the patient is receiving 40% of humidification for cold pot, and for 40% I should have it at 10 LPM, and I'll put it at 10 LPM, but this machine is not going up to 10 at all. I mean 10 liters, but it should be at 10 liters, okay? So now I'm going to look at the suction catheters. It's tipped over, but I see that there's plenty of them, and the size is appropriate to the patient's trach size. I'm going to go over to my emergency equipment over here. So I see an extra inner cannula, I see extra trach sets, dilators, extra trach ties, obturator, face plates, normal saline, sterile water, ambu bag. There's a cuff pressure check device, extra masks, and yeah. So that's done. My safety check is done. So I'm going to go ahead and pre-oxygenate the patient. So I'm going to max out my oxygen. It should go up to 15 liters, which is the max. And I'm going to ask the patient to take 2 to 3 deep breaths. Patient takes them, and I will make sure to monitor the ultrasat as well, and it's 100%. So I'm going to go ahead and remove the ultrasource. I'm going to grab my suctioning. I've already checked the suction range. Take that out. Grab a suctioning catheter. Connect it. Then I would leave 5 to 10 inches about here. I'm going to insert this into the patient's trach, and I'm going to stop it when I feel resistance, okay? And I'm not suctioning while I get in there. So in, intermittent suction, rotate for 5 to 10 seconds in the trach. Then I'm going to wrap this around my white gloves. I'm going to have it right there for garbage. Then I'm going to suction my suction tubing with sterile water. For demo purposes, I wouldn't do that. To clear out the tubing itself, then I'm going to put back the oral suctioning over here and leave it there for now. Then I'm going to remove my gloves put back the O2 source. Okay, and this is going to be all garbage. I'm going to come back over here and perform hand hygiene. I'm going to start to organize myself with the dressing tray. This is going to be my garbage bag. And I would not need this. That's going to be just garbage right there. That's also garbage. Making sure that I'm maintaining sterility here.
I'm just going to use these forceps.
I'm going to pour my manual cleaning in.
And I'm just going to do some more hand hygiene. I'm going to clean the area. As I'm cleaning it, I'm just going to
Staying away from the sterile
inspect the area as well.
Not disturb it. I'm going to add my cleaning sponges in.
Okay, so I'm going to start
It's also garbage. And then packages of cotton applicators. Nope. There's no need for that. I'm doing no touch. Okay. Garbage.
And I'm going to start by just cleaning.
Garbage. Alright, now I'm going to perform hand hygiene once more. Go ahead and apply my clean gloves on. Okay, then I'm going to take off the O2 source. Then I'm just going to stabilize the patient's tray. And then grab the old inner cannula. Take it out. I'm going to look for intactness. It's intact. I'm going to throw this out and dispose my gloves as well. I'm going to perform hand hygiene once more. Apply another pair of gloves. I'm going to open my new inner cannula. Making sure that I'm only touching the tip. And I'm going to just insert it in, stabilizing it. I hear a click, so it went in properly. Now I'm going to take out the old dressing of the patient's tray. I'm going to stabilize, take it out. I'm going to assess for the color and the amount of drainage if there is, and the dressing is very clean. That's going to be disposed as well as my gloves. I'm going to perform hand hygiene. And I'm going to assess the trach site as well. I don't see any redness, I don't see any swelling, no signs of infection, and there's no drainage present. So I'm going to go ahead and start to clean the patient's trach. Cotton applicators. Like normal saline. One swab.
No, never mind. Sorry, my forceps are sterile, so you can touch there, so that is okay. At this point,
One swipe.
Once more underneath.
Garbage. And I'm going to grab my 2x2s.
Okay, and then I'm just going to start to dry. Okay, that is a great sterility, so I would make sure to, I'd actually could just grab some of the forceps and just make sure not to use that side of my sterile field and just extend my sterile field with it. So I would get someone to hand me some forceps.
Okay.
And
Bottom part,
use that
one
side.
swipe for gauze. garbage. Okay, I'm just going to leave this WhatsApp away so that I can get into this top portion. One swipe for gauze, garbage. Okay, now I'm going to dry the tray site.
So now I'm going to apply
And with cotton applicator, do one swipe. One swipe. And because I just contaminated the bit of tray right there at the bottom portion, I would open another package.
So when applying the donut, I'm just going to be careful to only touch areas that I have cleaned with both the donut and
Garbage.
forceps.
Take the tip. Okay.
Using medical
And I would clean that part once more because I contaminated, so I would do this part once again, one swipe per cotton applicator and dry. And I'm doing this step again, just making sure that I cleaned it after contamination. And I'm gonna dry the rest of the area with 2x2s.
dry, making sponges.
Drying the bottom, one swipe for gauze, garbage. And I'm drying the top now, one swipe, and garbage. Okay? So at this point, I'm going to apply my clean gloves on, hand hygiene before that.
And then I'm just going to cut my 2x2.
And I'm going to apply my new dressing on, the clean sponges.
Now I'm ready to apply my fix here. I do have my date and time on the last one.
So I'm going to place it in here, just like that for now. Okay. Then I can move this just a bit over here now at this point because I don't need the sterile field. I'm going to use my fingers carefully, not touching the very middle portion of it. I'm going to stabilize the edges, pulling out only at the edges. Make sure that this trach itself is sterile. I'm going to go to the other side. Again, only touching the outside portions. Okay, just the outsides. My trach dressing is on, and now I'm going to reapply my O2 source for the patient. Okay, now I'm going to just readjust my oxygen to what's ordered, so 40% humidification, that's 8 liters. I'm lowering down. This oxygen is kind of broken, but it's supposed to be at 8 liters from 15 liters, okay? So I'm lowering down from 15 liters to 8 liters for 40% humidification according to this full pod system. Oh, nope, 10 liters. Sorry about that. It should be 10 liters. So, 10 liters. There you go. Okay, so yeah, again, making sure 40% humidification, 10 liters. My apologies. I was set it at 10 liters from 15 liters. So it's lowered it down to 10 liters, 40% humidification. Then I would, at this point, take off my gloves, perform hand hygiene. Okay, and I'm going to just tell the patient again. So everything is done. Have you had any troubles or any questions or concerns? Patient says no troubles or concerns. I'm going to go ahead and put the pillow back on for the patient.
So then I would make sure that the dressing is completely inclusive, which
Okay.
it is. I have my
And I'm going to clean up my bedside supplies, documents, saying that everything that I verbalized so far, like the assessments, like how the old dressing had no drainage, very clean, the old inner cannula, the actual trach site, patient tolerated wall, maintain procedure, and keep monitoring. Now I'm going to perform exit safety check so the patient is comfortable. I'm going to lower the height of the bed, and I'm going to check that there's a call bell in reach. There are no hazards in the environment, and the IV system is already checked in my previous video. And this is a separate skill set. And I'm going to leave the room.